The Welsh Government, in their 2018 Plan for Health and Social Care, put forward national design principles to drive change and transformation. There was an emphasis on using new technologies to support people in managing their own health and well-being, and to enable them to live independently. Now, if we go back to those principles that the Welsh Government put forward, from the evaluation we can see how EPMA and the patient portal align directly with them. The principles are prevention and early intervention. We saw how access to information on patient portal allows patients to maintain healthy lifestyles. Safety. Everybody involved in the care of the patient, including the patient themselves, shares the same knowledge about them, and so harm is minimized. Independence. The system supports self-care, for example, for patients on home dialysis treatments. Voice. Patients are informed about their condition and empowered to take an active part in managing it, and can easily contact those involved in their care to express concerns they may have about their health. Seamless care. Access to the same information by all healthcare services, renal and non-renal, enables that seamless transition of care between them. And most importantly, patients were happy. As a researcher, it's fantastic to get this feedback from the people you interview and to get an insider's view on how their lives have improved. For our evaluation, we took everything the patients told us and we mapped it against two different frameworks. Starting with the first framework, we looked at safety. It was clear that patients believed that the digital system has made care safer by allowing healthcare professionals to view the same up-to-date information. They particularly highlighted how using Patient View, the patient portal interface of the system, helped ensure that any treatment they received in non-renal settings, such as a dentist or the GP, would not cause any harm. The patient portal allowing them to actively manage their own condition. They did so by checking blood test results and medication changes live on their phone, and also by inputting their own data, such as blood pressure and volumes of dialysis fluid after home dialysis. They told us they felt in control, as they could monitor trends in the blood results to see whether the condition was improving or deteriorating, and use the targets that were given to know what to aim for. Patients also gave examples of how the digital system being used by staff had allowed their own preferences and needs to be taken into account, and how it actually increased bedside interactions. All patients discussed how this functionality increased timeliness of several aspects of their care. Staff had instant access to all information at the point of care on devices that were easily portable, and this allowed fast action when needed. The digital system was very efficient in receiving information about their treatment from staff, as opposed to receiving paper letters or phone calls. The digital system supported equity of care provision and monitoring for all patients, regardless of whether they dialyzed in the main hospital, a satellite unit, or independently at home. Patients on home dialysis felt reassured that they would receive the same standard of monitoring as if they were in hospital. For physical health, examples were provided by different patients of how the patient portal was used to adjust diet according to blood test results, for example, abnormal potassium levels, and to continue with hobbies that involved exercise. To receive the blood results in a timely manner supported patients to feel reassured and alleviated any anxiety, providing peace of mind and having a positive impact on their mental health. We had examples of how the patient portal helped patients with their careers, their hobbies and social lives. The delivery team from Swansea visited 16 dialysis units across Wales to roll out EPMA, giving one-to-one training and a catalogue of short training videos to help staff get used to the system. I was there during one of these visits and experienced myself the engagement of the staff with the team and the value of this tailored approach to the introduction of the system, which was followed by ongoing clinical and technical support remotely. This meant that the staff engaged from the start and made the most of it. The EPMA project provided the foundations for a wider programme of digitisation. This regional blueprint for cross-health boards working was used for national upscaling, ensuring what worked for one part of Wales could work for all parts of Wales. In other words, equitable healthcare.